The visibility of Oncology Pharmacist study, that's a personal, that's closer to my heart, because that's based on a personal experience that I had. Last year my daughter was diagnosed with cancer, and I experienced the patient journey from the other side. So I've always been the oncology pharmacist, the researcher, but this time I was the carer and in the system. And I couldn't help but notice that throughout this difficult time, where there's lots of overwhelming information being given and a lot of instructions, and you're upset at the same time, the pharmacist was not visible to us, to the patients. Now, because I'm a pharmacist, I know exactly how important the role of the pharmacist is, and I knew exactly how I could get in touch with them and to ask them questions when I needed. But what I thought about was, if somebody else without my background, they won't have that knowledge and they won't feel as supported. So that's why I decided to do that study. And I wanted to do it in two phases. So the first phase, I asked parents of children living with cancer to reflect upon their experience, to reflect on their journey, and to tell me whether the pharmacist was present, whether they felt the pharmacist was important, contributed to their care. And the results were quite similar to mine, is that the pharmacist across all sectors, tertiary, secondary and primary, the pharmacist was quite invisible. And then from the other side, so I developed another survey, and I surveyed oncology pharmacists and I asked them to reflect on their visibility, and the results were quite similar. So a significant number of oncology pharmacists who responded to the survey indicated that they spend less than 10% of their time in face-to-face with the patient. They're always behind the scene. And when I asked them what they would like to do, there was a huge disparity between what they're doing at the moment and what would they like to do, as they prefer to have more contact with patients, as they feel that they can have a huge impact on improving their outcomes. So even though these surveys weren't necessarily huge, but they are indicative of a problem, or of something that we need to think about as pharmacists. Is it really strategic for us to be so invisible to patients? Can we do things differently so that so patients see us more as part of their journey and we can support them more? A difficult situation, because we know that pharmacists are pulled in all sorts of directions, and they are often behind the scenes. So one way that was discussed actually today at BOPA is, can artificial intelligence or can technology support pharmacists in a way that it relieves them of, for example, simple screening, simple chemotherapy screening, because that at the moment is a huge part of their day. So if they can be relieved of part of it, then that time that they're not spent screening can be spent face-to-face with the patient, answering their queries, supporting them and addressing their needs.